Hello everyone, welcome to MBBS classes. Myself Dr. Hanifa. Today in this video we'll discuss about the anatomy of tympanic membrane. So let's begin with what is the characteristic of normal tympanic membrane. So as we have discussed in the class of external auditory canal and anatomy, that this tympanic membrane, it is a partition wall between the external auditory canal and the middle ear cavity. So this is a normal tympanic membrane. So what are the characteristics? The shape, if you see here, the shape of the tympanic membrane is elliptical, or you can see it as oval. It is oval in shape, but it is not a flat surface. It is concave shaped. The concavity is towards the external auditory canal and the convexity is towards the middle ear cavity. The ideal color of a normal tympanic membrane is pearly white or gray in color, and it is translucent. It is translucent in few patients. It is due to the translucency, the inner structures of the middle ear cavity can also be seen. Position, it has a peculiar position that it is placed obliquely at a degree of 55 degree to the external auditory canal in such a way that the anterior canal wall and the floor of the external auditory canal is longer than the posterior canal wall and the roof. So it is because of the obliquity of the tympanic membrane, the canal wall, anterior wall is longer. Now coming to the dimension, since it is elliptical, the height is approximately around 10 mm and the width is around 8 mm length. A normal tympanic membrane should be mobile. The mobility can be tested by either doing the Valsalva maneuver or by doing the pneumatic otoscopic examination. So this is a picture showing the position of the tympanic membrane. As you can see in this diagram, it is a partition wall between the external auditory canal and the middle ear cavity. And you can see that it is not vertically placed, it is placed little bit obliquely. It has two surfaces. This is the lateral surface which is facing towards the external auditory canal, and the medial surface it faces towards the middle ear cavity. As I told you that it is little bit concave shaped. So see, this is the concave part. The concavity is outwards and the convexity is towards the middle ear cavity. This convexity is maintained by the umbo, which is the area of the attachment of the handle of the malleus to the middle part of the membrane. So now coming to the layers of the tympanic membrane. The tympanic membrane is not a single layer of membrane. It has three different type of layers. So now what are the three different layers? The outermost layer in this schematic diagram, you can see that the outermost layer is or you can say the lateralmost layer is the epithelial layer. This epithelial layer is continuous with the epithelium of the external auditory canal. Then next to the epithelial layer, the middle layer is the fibrous layer, or we call it lamina propria. This fibrous layer is not present in throughout the tympanic membrane. We will see that tympanic membrane has two parts. It is the pars tensa, which forms the majority of the tympanic membrane, and the pars flaccida. So in the pars tensa, this fibrous layer is present, whereas in the pars flaccida, this fibrous layer is absent. Now next, the innermost layer the medialmost layer is the mucosal layer, which is continuous with the mucosa of the middle ear cavity. So this epithelial layer, which is the outermost layer, which is continuous with the epithelial layer of the external auditory canal, it consists of only two layers of cells. There is some peculiarity about the way the fibrous layer is arranged in case of the tympanic membrane. The fibrous layer is also known as the lamina propria. So it has a peculiar spiderweb arrangement of fibers. So how it is formed? This spiderweb arrangement is formed by two layers, two different, you can say that two different layers of the fibrous layer. The outer fibrous layer is made up of, or it consists of, radial fibers. You can see in this diagram, these are the radial fibers which originates from the handle of the malleus. This is the handle of the malleus, this is the pars tensa, and this is the fibrous annulus. So the fibrous layer, it starts from the handle of the malleus up to the fibrous annulus. They are arranged in a radial pattern like a spokes of a wheel. The inner fibrous layer is not radial. It is arranged in a circular manner, mainly towards the periphery. So the outer layer, fibrous layer, is radial pattern. The inner fibrous layer is the circular pattern. And when they join together, they give, this is the ultimate final look of the schematic diagram. We can say this is the final schematic diagram of the spiderweb arrangement of the fibrous layer. And the mucosal layer, it is a respiratory type of epithelium, mainly ciliated columnar in the anteroinferior quadrant, which becomes a few cuboidal cells in the upper part of the middle ear cavity. So this is the medial surface of the tympanic membrane, which is facing towards the middle ear cavity. As you can see here, this tympanic membrane is thickened at the periphery to form a fibrocartilaginous annulus, or we call it a fibrous annulus. So this thickened rim, as you can see around at the circumference, is known as the fibrous annulus. This fibrous annulus, it sits comfortably in a bony sulcus in the tympanic part of the temporal bone. So this tympanic part of the temporal bone, or the tympanic sulcus, this is the bony sulcus, uh, which which is like a seat for this tympanic membrane. But as you can see in this diagram, that this bony sulcus is not present in the superior part. The area where this bony sulcus is absent is known as the notch of Rivenus. So the pars tensa, it sits in the tympanic bony sulcus, whereas the area of the membrane where this bony sulcus is absent, in the area of the notch of Rivenus, this area is known as the pars flaccida. So the convexity of the medial surface of the tympanic membrane is maintained by the handle of the malleus. This is malleus, this is incus, and this is stapes. These are the three ossicles of the middle ear cavity. So to the medial surface of the tympanic membrane, this handle of the malleus is attached, and this site of the maximum convexity is known as the umbo. Umbo is basically a Latin word which means the knob on the warrior's shield. So the medial surface is related to the ossicles. This is a microscopic image of the tympanic membrane. So we all know that tympanic membrane has three layers. The outermost layer, this is the epidermal layer. This is the the middle layer is the fibrous layer, which has again two parts. This is radial arrangement of the collagenous fibers, and the inner layer of the fibrous layer is the circular layers, that is the circular collagenous fibers, and the medial most layer is the mucosal layer. So now what are the parts of tympanic membrane? It is important to know that the tympanic membrane, during any clinical examination, we have to know the parts, because we label the disease as per its topography, or you can say we label the disease as per its location. So the tympanic membrane, it has two parts. The lowermost part, or the majority of the part, this part is known as the pars tensa, and this upper smaller triangular part is known as the pars flaccida. So why it is known as pars tensa? This pars tensa, it contains the middle fibrous layer. Because of its tense position, it is known as pars tensa. This texture is provided by two factors. First is the presence of the fibrous layer in the pars tensa, and second is due to the attachment of the handle of the malleus, which provides its the strength. But in case of the pars flaccida, which lies above this pars tensa, here the fibrous layer is absent. In this layer, in this area of the pars flaccida, the bony tympanic annulus is absent. So if you see here, this is the tympanic membrane which is thickened at the circumference to form the annulus. Here it sits in the bony sulcus, tympanic bony sulcus. This tympanic bony sulcus, it starts from here. It is a continuous curve till here. So the part of the membrane which is above this bony sulcus is known as pars flaccida or the Schrapplin's membrane. Now coming to the landmarks of the tympanic membrane. A normal tympanic membrane, as we have discussed, it is elliptical in shape. It is translucent, and it is mobile. Mobility is tested by Valsalva maneuver. But here, what are the landmarks of the normal tympanic membrane? So this is a picture of a right tympanic membrane. This is the cone of light. So cone of light is always present in the antero-inferior quadrant. So this is the cone of light. You can see the light is here. This is the handle of malleus. This knob-like structure is the umbo, where the tympanic membrane is attached medially, and this area is the area of maximum convexity. This is the fibrous annulus. This projection from the handle of the malleus is known as the lateral process of malleus. From here, the lateral process of malleus, the fibrous layer, it condenses to form the two malleolar folds up to the area of the anterior tympanic spine and the posterior tympanic spine. These anterior tympanic spine and posterior tympanic spine, these areas, they signify the area where the bony tympanic annulus they finishes. Or you can say that in this area the bony tympanic annulus is not present, and the fibrous layer, it condenses from the area of lateral malleolar process to the respective tympanic spines to form the anterior malleolar fold and posterior malleolar fold. So the part of the membrane which is above the malleolar fold is known as the pars flaccida. So this is the pars flaccida which is above this anterior and posterior malleolar folds. So here we have given two pictures of the tympanic membrane just to highlight one point, how to identify the side of the tympanic membrane. So just remember, the side of the tympanic membrane is identified by the position of, mainly we look for the cone of light. So cone of light, this is the area cone of light. So you can see this is a area which is well illuminated. So cone of light is always present in the antero-inferior quadrant. So since this is the cone of light, so this part will be the anterior part. This will be the posterior part of the TM. So this is the right tympanic membrane. If you see here, this is the cone of light, very well seen. So this will be the interior of the tympanic membrane. This part will be the posterior part of the tympanic membrane. So the cone of the light helps us to identify the site of the tympanic membrane if it is given only as the picture form. So let's see how the tympanic membrane is divided into quadrants. Actually, the tympanic membrane is divided into quadrants just for the clinical purpose, to mark the area of the disease, to mark the area of the perforation. So how it is divided? It is divided into four quadrants. The quadrants are antero-superior quadrants. This is the antero-inferior quadrant. This is the posterior-superior quadrant and posterior-inferior quadrant. So why it is antero-superior? First we will look for the cone of light. This is the cone of light. That means it is the antero-inferior quadrant. But how it is divided? It is divided by a line, imaginary line drawn along the handle of the malleus. So the first line is drawn along the handle of the malleus, and the second line is drawn perpendicular to the first line at the level of umbo. So if this is the handle of the malleus, if we are drawing an imaginary line, this will be the first line. This is the umbo. So when we draw a line perpendicular to the first line at the level of umbo, this is the second line. So it is divided into four quadrants. The upper interior is known as antero-superior quadrant. This is the lower interior, that is the antero-inferior, posterior-inferior quadrant, and posterior-superior quadrants. Now coming to the blood supply of the tympanic membrane. The lateral surface of the tympanic membrane is supplied by deep auricular branch of maxillary artery. The medial surface is supplied by multiple branches like anterior tympanic artery, which is a branch of internal maxillary artery. The second artery which supplies the medial surface is the posterior tympanic artery, which is a branch of stylomastoid artery and the branches of middle meningeal artery. So as you can see here, these arteries, they form a vascular ring around the tympanic membrane. They form basically a plexus type plexus around the tympanic membrane. So these vessels, they run circumferentially, and from the circumference they give multiple vessels along the radially. So these vessels, they have the radial arrangement. These are the radial branches. This is the circumferential arrangement of the vessel, and the vessels which run along the handle of the malleus, they are known as the manubrial branch. So if you see the fibers of the tympanic membrane, the blood supply of the tympanic membrane, the arrangement or the pattern is more or less similar. Now coming to the nerve supply. So just like the external ear, the tympanic membrane is also supplied by multiple nerves. So as you all know, the tympanic membrane has two surfaces. The outer surface is known as the lateral surface, and the inner surface is known as the medial surface. Now let's see the nerve supply of lateral surface. The lateral surface is supplied by, as you can see in this diagram, the anterior half of the lateral surface is supplied by auriculotemporal nerve, which is a branch of mandibular division of trigeminal nerve. The posterior part of the lateral surface of the tympanic membrane is supplied by auricular branch of vagus nerve, which is also called as Arnold's nerve. There is one more nerve which contributes to the nerve supply of the lateral surface, is the facial nerve. This facial nerve, it it gives a branch to the auricular branch of vagus nerve on its exit through the stylomastoid foramen. So the posterior part of the tympanic membrane, the lateral surface, is supplied by vagus nerve and the small contribution by facial nerve. The whole of the medial surface of the tympanic membrane is supplied by tympanic branch of glossopharyngeal nerve, which is also known as Jacobson's nerve. Now we are discussing about the anatomy. Just let's discuss little bit about the function of the tympanic membrane. The functions, the functions in detail, it will be covered in the physiology video. But what is the basic function? The basic function of tympanic membrane is sound transmission and amplification. So what happens as soon as the sound waves this strike the tympanic membrane? These sound waves, on striking the tympanic membrane, it sets the tympanic membrane into motion. And because of the spiderweb arrangement of the fibers, the tympanic membrane, it vibrates. Then these vibrations, they are transmitted to the ossicles of the middle ear. The ossicles of the middle ear are malleus, which is attached immediately to the tympanic membrane, incus and stapes. So from this malleus to incus and then from incus to the stapes, this sound wave is transmitted or it's passed on to the cochlea of the inner ear. Now little bit about the applied anatomy. So in the uh, tympanic membrane, there are different type of incisions which is given. We called it as myringotomy. Myring means tympanic membrane. Tomy means just to make an incision. So there are two type of incisions. This is the one is the radial incision, as you can see here. Radial, that means along the parallel to the arrangement of the radial fibers. And this is another type of incision, a curve type. It is also known as the circumferential type of incisions. So the circumferential type of incision is given in case of acute suppurative otitis media. Generally, it is given in the posterior inferior quadrant between the umbo and the annulus. The radial incision is given along the parallel to the radial fibers. It is given in cases of otitis media with effusion. So because of the peculiar arrangement of the vessels in the tympanic membrane, in case of ASOM, that is acute suppurative otitis media, in the stage of hyperemia, there are certain stages of acute suppurative otitis media. In the stage of hyperemia, because of this peculiar arrangement of the blood supply, in the initial stages, the tympanic membrane, the flushing of the tympanic membrane, it happens in this manner, similar to the manner of the pattern of blood supply. So, sometimes it is also known as the cartwheel type of look in case of ASOM in the initial stages. Now, what is the importance of local anesthesia in relation to tympanic membrane here? So if you remember, the posterior part of the tympanic membrane is supplied by vagus nerve, that is the auricular branch of vagus nerve, and with little contribution from the facial nerve. So what happens is that if a local anesthesia is given, this is the pinna, this is the area of the mastoid area. So when a local anesthesia is given on the anterior surface of the mastoid and into the tympanic plate, this local anesthesia at this area is sufficient to do myringotomy in the elderly patients. So this is all about the anatomy of tympanic membrane. Thank you for watching this video.